individual, mostly because that's what public health used to come from, that perspective. The doctor's telling the individual, you need to get out of this situation. He's not taking into account his environment. He's not taking into account his support system. He's not looking at the community that's making these policies available to this person. How come there's not someone there looking at the policies around that? They're not looking at it from that perspective. And that's the change that we have seen over time, saying, you know what, we need to expand our thought process. How can we ensure that families are healthy beyond just the medical model? And the question has come up so many times, are people just making bad choices? I mean, I hear this over and over again. It's unreasonable to expect people to change their behavior easily when so many forces in their social, cultural, and physical environment conspire against such a change. We're recently looking at obesity, one of the biggest issues right now in the country. You can see from the president's perspective, the First Lady has this whole obesity initiative. We're seeing for the first time that kids are not expected to live as long as their parents because of obesity. The rate of overweight kids has doubled in the past 30 years, and 78% don't get enough physical activity. It's their environment in which they live in. So what can we do to help people make better choices? Our food environment. How many of you can count the number of fast food in your neighborhood in comparison to healthy foods or supermarkets? Is it more fast foods or more supermarkets? In my neighborhood, in a 1 mile radius, I counted, there are approximately 13 fast food chains in 1 mile. There are 2 supermarkets and a farmer's market. But if you look at the choices that are available to families and the climate that we're living in right now, the options that they can choose from in regards to fast foods and healthy foods are clearly outweighing their options of choice. And sometimes families will choose to take fast food. It's cheaper, it's not as healthy. I mean, I will give credit, they are trying to include healthy items on the meal, but if you're going to McDonald's, you don't really want the apples, so you want the fried french fries, you know? But they are including things on their menu so that people can make healthier choices. But once again, you always have that other choice of choosing bad foods. And our environment is totally taking on this whole obesity and food initiative that is going on in our country right now, and specifically here in San Diego. So the county has been looking at, through our public health department, looking at strategies to improve youth health by looking at the environment. We're talking about safer street design. People are not getting as physically active. Well, will you walk in your community if you have a high rate of crime? Would you walk in your community if there's no access for street sidewalks? If it's not safe, it's not pedestrian friendly? If you don't have any parks available to get out to do physical activity, chances are not. We're also working with healthier redevelopment projects. When people are coming to design and build in your community, are they looking at it from a health perspective? Are they including it from a health component? Are they even putting health into that? So when they're building these buildings, are they building them close to playgrounds? Are they building them close to homes that they may have any chemical toxins? We hope not, but we need to make sure that they're looking at it from a health component. Working with your city planners. We've been working with a lot of the city planners here in San Diego County, looking at how they can add health into their community plan updates, so that when they are building those streets, making sure that they're not making major highways and having only little sidewalks. So making sure that they have bicycle lanes, making sure they have walkable sidewalks, making sure they have safe routes to school so that children can get to school by walking. A question we had asked is, how many of you walked to school when you were younger? How many of your children walk to school now? If you have children. Okay. If you were to have children in the future, how many would let your children walk to school? Depending, exactly. So we're looking at this when you're designing your community, making sure that it's physically appropriate for families to take advantage of doing recreation and walking. And also looking at eliminating food deserts. In one area in San Diego we're focusing on is Southeast San Diego. And we have clients that we serve in this area. One client uses the liquor store as her primary source of food. The reason why is because she can't get to the local supermarket because of transportation issues. Once again, when you're working with your city planners, making sure that they have access to transportation to get to grocery stores. And the liquor store that she goes to, sometimes it has healthy foods, but the prices are very high. The quality is not that great. So her option to feed her newborn is something at the liquor store. So we're working with the community so we can bring in community gardens, farmers markets, so that this person can have access and the community can have access to quality food.
Yeah. I live by a Vaughn's and a Rouse, and they're in a shopping center. There are no public sidewalks into the shopping centers. You can't even get to the grocery store on a public sidewalk. You have to walk in the lanes where the cars are coming out.
Exactly. So you have families who are, you're saying, you're not going to want to walk to the grocery store, because of the condition of how to get there.
It's unsafe.
Unsafe. And the one way we're trying to do that is working with the city planners, working with communities so that they can advocate and empower change through policy, through systems change, working with that liquor store possibly. We have a community garden in your area. Would you be willing to purchase produce from that community garden? Would you be willing to purchase produce from the farmers market? So that if this is the only area for a family to get fresh foods, at least he's providing the highest quality that's available and maybe making sure the cost is effective and efficient for families to actually access food. And so these are some of the things that we have been doing. And we also have seen a major shift from the Centers for Disease Control in making sure that families have the resources. We recently received a grant from CDC and the feds for $60 million here in San Diego County. And part of that will be working with the schools, working with communities, working with land use, working with the SANDAG, San Diego government, so that we can start making some of these system changes and policy changes so that we can see improvements in health from the social point, not just in accessing a doctor or going to getting preventive health care, but making sure that once the people leave their doctor, when they go back into their environment, that they do have healthy choices and so that they can change their behavior and make the appropriate health options for them. And so that's the end of my part. Questions?
As more of probably a suggestion is that the public doesn't know how bad some of the bad food out there is, and yet wouldn't it be good to educate them that they're, like the food tastes good, but it's actually poisoning their body, and maybe getting that message across to help them understand that it's, what they're eating, portions, the amount, but like they're finding out about sugar and what it's doing to people. There's a lot out there that's poisoning the people, yet people don't realize that.
Right, and I think there's twofold. The education is key. Like I said, you need to let the people know, but then at the same time, they need to have those healthier options available to them in their community. So it's both.
So on TV they advertise, that this is good food for you, and it is. They're lying.
Yeah.
And yet we're going on. Okay, they said it's good for us. We're going to eat it, and boy, it tastes good. So let's eat more. And next thing you know.
And everything is larger now. All your portions are larger. It's cheaper to get a supersized meal than it is to just get a Happy Meal.
And then they get a kid to exercise. Well, do you think they want to exercise after eating all that sugar or all that starch? Whatever's out there that they're eating that's not good for them. And get them out there and walk or exercise and play.
Right. And then once again, you have to make sure the environment for them to do that, play, making sure that they have safe parks in their community to do that. So I think it's key to have the education, but then also you have to have the environment to sustain that activity, the education and purchasing healthy foods.
Helping them understand how much it actually is affecting them. People think it's not, but they got to realize it is poison.
Yeah.
I work, I'm a teacher in a high school and I teach 3 courses, and you said you
school